If you're a healthcare professional who wants to know how to treat spider veins on the face and legs, you're in the right place. There are three important differences between spider veins on the legs and spider veins on the face that you as a doctor or nurse must know before you make your decision about treating them. But before I get on to the differences, let's start by saying what they are and what they look like. And if you stick around to the end, I'll also tell you which spider veins are the easiest to learn how to treat. Spider veins on the face or spider veins on the legs. So what exactly are spider veins? Well, they're defined as blood vessels in the skin up to 1 millimetre in size. They're also known as thread veins or broken veins, and the medical term for these veins is telangiectasia. Spider veins have a typical appearance and most people instantly recognise them. On the legs, they can occur anywhere, but they're frequently found on the outer thigh, the inner calf, and around the ankle. On the face, they're typically found on the chin, cheeks, and nose. That's where the similarities end. Important difference number one. For most people who don't have rosacea, spider veins on the face have no medical cause. Not so spider veins on the legs. On the legs, there is usually a feeder vein causing the problem, and special tests may be necessary to find these feeder veins. My favourite gadget for detecting feeder veins for spider veins on the legs is the vein light. Spider veins around the ankle are also an important indicator of a medical condition called superficial venous reflux, which can be a cause of leg ulcers and phlebitis. Many experts advise that everyone with spider veins on the legs should have a duplex ultrasound scan to check the deeper veins are healthy. Now, I think this is going a bit overboard. I don't think everyone needs a duplex ultrasound scan. I think if your patient has leg spider veins, that they have no symptoms, the skin of the leg is healthy, and you perform a special test called a continuous wave Doppler ultrasound, then they don't need a full duplex ultrasound scan. Important difference number two. Spider veins on the face are nearly always a cosmetic concern, and they can usually be treated straight away without any special tests. Spider veins on the legs are frequently a medical concern as well, and a careful assessment by a continuous wave Doppler is important, and if that is positive, a duplex ultrasound scan is needed. Important difference number three. Spider veins on the face can be safely and effectively treated by laser, intense pulse light, or shortwave diathermy. These three types of treatment all work by applying heat energy to the blood vessel, sealing it and dispersing it. Now, of these three options, I use shortwave diathermy as it is the most cost-effective solution. My favourite shortwave diathermy machine costs less than £900 and disposables are less than £10 per treatment session. In contrast, these heat-based treatments are not effective on the legs. In fact, they can sometimes make things worse. Spider veins on the legs are best treated by microinjections called microsclerotherapy. Now, if you're a healthcare professional and you want to know more about microsclerotherapy and shortwave diathermy, download my free guide. The link is in the description box below. So at the beginning, I said I would tell you which spider veins are the easiest to learn how to treat. Spider veins on the face or spider veins on the legs? Well, the answer is, without doubt, spider veins on the face. Now, why is this? Well, as I've said previously, for most people, spider veins on the face have no underlying cause, so you don't need to know a lot of theory, and you don't need access to special tests or investigations. You can get on and treat these pretty much straight away. Secondly, the actual technique is much easier. Microsclerotherapy injections are technically quite difficult to learn, and you need to practice the technique frequently. My experience of training doctors and nurses over many years is that provided you have good eyesight and a steady hand, it takes less than an hour to learn how to apply the medical current to the spider veins by shortwave diathermy. With a small amount of practical knowledge, you can learn how to get great results in less than an afternoon. Now, if you want to know more about my courses, click the links in the description box below. If you found this information valuable, please consider hitting the like button. It really does help my channel. And check out all the links in the description box below. Why not leave me a question or a comment? I look forward to reading all of these, and I promise that I'll get back to you as soon as I can. I hope to see you again soon, so don't forget to hit the subscribe button so you don't miss my next video. Thank you for staying to the end, and thank you for watching.